Welcome back at 7:15. May is National Osteoporosis Awareness and Prevention Month. About 10 million Americans are diagnosed with osteoporosis, and the condition is responsible for an estimated 2 million broken bones each year. With us this morning to discuss ways people can prevent the disease is Dr. Brent Wallis from People's Health. Dr. Wallis, good morning. Thanks for being with us.
Good morning. Thanks for having me.
So let's first start off with the definition of osteoporosis. Everyone's heard of it before, but I don't know if everyone fully understands what this disease is. Can you explain it to us, please?
Yeah, sure. So osteoporosis it's a disease that causes weakening of the bones over time. It really makes them thin and more brittle, and like the name says, porous, so full of holes. And whenever that happens to your bones, they're going to become weaker and more likely to break, actually, if you have, a simple fall or maybe even a slight stress, something like a strong cough or you bend over too quickly.
And what are some of the symptoms of this disease, if any at all?
Yeah, quite often there are no symptoms. It's considered one of those silent diseases, and sometimes the first time we know about osteoporosis is actually when you do have a fracture. So that may be the first indication. Some hints that there may be something going on. You'll notice as people get older, sometimes they get shorter. They may hunch over slightly, and that can actually be a cause of osteoporosis.
I know in the past, if people have ever heard of osteoporosis, they often associate it with older women, but can men also be at risk for developing osteoporosis?
Yeah, absolutely. Age definitely plays a major role, and women, like you said, are about 4 times more likely than men to develop osteoporosis, but men certainly can get it. In particular, very thin men, the less weight you have on you, the less stress you put on your bones, and that actually makes them become more brittle. So men can definitely get it. Another condition, too, is prostate cancer, and some of the treatments we do for prostate cancer that men are subject to can actually result in osteoporosis as well.
We were showing a couple seconds ago some video of fruits and vegetables and different types of food. Is food something or diet something that you can kind of monitor that could help lower your chances of developing osteoporosis? And what else can you do to prevent developing osteoporosis?
Yeah, absolutely. Diet, like in so many medical conditions, diet plays a huge role. And so you want to make sure that you're eating a diet really rich in calcium and in particular vitamin D as well, because that helps your body use the calcium. You want to really limit your alcohol consumption and don't smoke at all. Alcohol and tobacco can actually increase your risk for osteoporosis. And really, one of the most important things that you can do is exercise. Exercise is critical, and it's kind of low impact type exercises that can both strengthen your muscles, but they also strengthen the bones and reduce your risk for fractures if you do develop osteoporosis.
Well, Dr. Wallis, we appreciate your time this morning during this National Osteoporosis Prevention or Awareness and Prevention Month, letting people know what the signs and symptoms are and hoping people can maybe change their lifestyles, hoping to prevent the development of this disease. We appreciate your time this morning.
Yeah, thank you very much. Have a great weekend.
You too.